We discussed the Senate's ACA repeal and replace bill last week. Just yesterday, they released the updated version. Let's get you up to speed. This is Healthcare Triage breaking news. It's still called the Better Care Reconciliation Act, or BCRA, and it still does much of what we talked about last week. Cuts subsidies for most people, changes them to age-based rather than earning-based, increases the age bands, cuts Medicaid massively. So let's get to the differences. The revised bill made some changes to the tax cuts. The 0.9% investment tax and the 3.8% Medicare payroll surtax are staying. Those hit the rich, and they account for $231 billion over the next decade. That clawed back $231 billion does not go to Medicaid, though, nor to the subsidies. Where does it go? An additional $70 billion is earmarked to help states with problems that might arise. These funds could be applied to help make premiums cheaper, or supplement cost sharing, set up high-risk pools, lots of other stuff. This means there's about $180 billion now for these efforts in the Senate bill, and states are going to need every penny of it. It's also now possible with updates to use money from health savings accounts to pay for premiums. This will mean that everyone, not just employed people, can use pre-tax dollars to buy insurance. This is nice for people who make enough money to care about pre-tax dollars. But it won't do much for the many, many poor Americans who don't pay any income tax. There's an additional $45 billion to fight the opioid epidemic. This was a sticking point for some senators who saw the big Medicaid cuts as detrimental to fighting addiction. Whether $45 billion is enough remains to be seen. There are changes in what we call disproportionate share hospital payments. Back in the day, these used to go to hospitals that cared for the uninsured. They went down with the ACA, though, because fewer people were uninsured. The updated BCRA changes the calculation to favor hospitals and doctors who care for the uninsured again. New to this bill is also a provision that allows people to use tax credits to purchase catastrophic plans. The ACA wanted people to buy more comprehensive plans, so while it allowed some thin catastrophic plans in some cases, it incentivized against them. No longer. Of course, these plans are still only good if you're healthy. The biggest potential change comes courtesy of Ted Cruz. It's the Consumer Choice Amendment, and here's the gist of it. It will give insurance companies permission to offer cheap, skimpy plans on the exchanges as long as they also offer a full-throated comprehensive plan like we see today. But let's be clear. The cheaper plans would likely exclude lots of stuff like mental health care, maternity care, contraception, stuff like that. They might even have caps or limits or refuse to cover some drugs or even hospitalizations. What pretty much every expert thinks would happen is that healthy people would buy the skimpier plans. If you're healthy, you're not gonna have a baby, blah, 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 you can get minimal coverage. But that means that the cheap people would all go to one side, leaving people on the other side who need more care to buy the more expensive comprehensive plans. This is adverse selection. It would make the comprehensive plans even more expensive, which would drive even more healthy people out to the other side. The people who would need care the most would wind up with significantly more expensive plans and likely a lot more cost sharing. Given that the plans in place already in BCRA come with a likely $6,000 deductible, making the premiums much more expensive will put them out of reach for many Americans. We should also recognize that the cheaper plans over here don't count for continuous coverage. So if you have a cheap plan and then you get sick, you need to wait a while before you can buy the comprehensive plan. You could be screwed. Supporters of this amendment likely believe that people should pay a lot more to cover their healthcare spending. Others shouldn't have to pay for them. Okay, we just need to be clear about that. It's a major policy change, and it will mean that many people will have to go without or spend huge proportions of their income for care. It's also important to note that this update doesn't change the big aspects of BCRA that already existed already, like the much lower subsidies and huge Medicaid cuts that could lead to significant numbers of Americans going uninsured in the next decade. Bottom line, if you're wealthy and/or healthy, these changes look pretty good for you. If you're sick or poor, not so much. And if you like Medicaid, there's a lot to dislike even in this revised bill. We need a CBO score. One is hopefully coming next week. And when it does, we'll let you know what it says here at Healthcare Triage News. Healthcare Triage is funded in part by viewers like you through Patreon, a service that allows you to support the show through a monthly donation. Your support makes this show bigger and better. We'd especially like to thank Joe Sevitz and Sam. Thanks, Joe. Thanks, Sam. More information can be found at patreon.com/healthcaretriage.